Welcome to the Movement Upgraded podcast. I'm your host, Dr. Jen Hosler, licensed physical therapist and certified strength and mobility coach. Here you can expect to hear about all things movement. The Movement Upgraded podcast is a blend of the science of strength training, rehab, and mobility, mixed with the personal and professional experience to provide you with the steps you need to keep your body pain-free and moving well, so you can do what you love forever. Hello, and welcome back. This is episode 10, and we are going to be covering osteoarthritis and lifting. So this was a request that I got from somebody on Instagram, and honestly, I really am glad that she suggested this because I'm going to cover some things that I think a lot of people have dealt with in the medical system, and you're probably going to actually learn quite a bit in this episode. So if you've ever been diagnosed with osteoarthritis, been told you have bone on bone, or have some wear and tear, I'm going to talk about those phrases and how unhelpful they are. And we're going to talk about what recommendations the evidence really has for arthritis and whether or not you should be lifting. So I'm going to talk about a little bit of research in here, and we're going to talk about some of the older recommendations versus how we kind of look at things now. This is going to kind of tie in some of the things that I talked about in my own story, as well as the Pain Science podcast episodes. So this is kind of a great podcast to kind of tie everything in and apply it to something very specific like OA or osteoarthritis. So the old view of kind of how the body is and arthritis is that we are basically just a bunch of bones that are stacked on top of each other, and that when you have some sort of MRI finding that is bone on bone, there's nothing you can do because you have lost the cartilage, and now those bones are just going to wear and tear and get worse and worse as you get older. The problem with this is it's extremely reductionistic. It's not exactly how the body works. It's very fear-based and perpetuates a sense of fragility, meaning it makes us feel very fragile, like anything we do is going to be like damaging to our bodies. That's the idea of fragility, instead of the opposite, which would be an idea of resilience and adaptability. Wow, those words are hard today. And resilience and adaptability just means that our bodies are super resilient. They adapt very well to stressors, and is basically what we want to trend more towards. But the older views of how we kind of approach musculoskeletal injuries and pain is very fear-based and perpetuates a lot of fragility. And that makes you feel very afraid to move. Maybe it makes you afraid to put load on your body, makes you feel fragile. And that fear will affect your life 1,000 times more than the actual diagnosis or problem you're experiencing majority of the time. I will put that little caveat in there because, it's not always, but majority of the time, the fear, especially when it comes to arthritis, the fear about the diagnosis is going to be more problematic for you than the actual diagnosis or problem. And this goes back to the Pain Science episodes that we had listened to earlier, where we talked about how pain is very much an experience that is affected by our emotions and our fears, as well as the loads on our body. And obviously, your fear is going to make your body feel, or your nervous system feel, less safe. And so the more fearful we are, the less safe we feel, the more pain we're definitely going to experience. And that is going to be problematic because eventually, as we get more and more afraid of loading our bodies, we get weaker and we have more issues. And there are going to be more problems from fear and then from getting weaker and not moving throughout our lives because of a diagnosis like arthritis than there would be if we were to not be afraid and just have arthritis and slowly, gradually work through what we're experiencing. Now, I will say we're going to talk at the end a little bit about if you have this diagnosis, things you should consider, things you should consider for finding a provider who can help you. But there are definitely some things that you can do. And so I just don't want you to think I'm going to leave you hanging with saying just don't be afraid. It's fine, because clearly you're probably experiencing some pain. Otherwise, you probably wouldn't have known you had arthritis or wouldn't be looking for some sort of solution. So that being said, I am very, very strongly not opinionated, but I'm very adamant about these types of messages, which I've talked about in I think episode 3, where I talked about my story. But all of what I just explained, the older version of kind of how we approached arthritis and injuries, is very much close to my heart because of my 2 experiences with issues, first with my scoliosis diagnosis, but mostly with my knee pain and knee injury that I had. I had torn my ACL when I was 14. If you haven't listened to it, we'll just briefly summarize, and had a surgery that was a graft for my ACL, but also I had torn both my medial and lateral meniscus, and they stitched the lateral and the medial, they just carved it away a little bit. And they told me I had a ton of damage in my knee, like it was destroyed. They told me lots of fear-mongering information, that I was definitely had so much damage in that knee that I would probably need a knee replacement eventually. It was bad, all of these types of things. But they also told me that the ACL was so strong and be more likely to tear my other ACL before I would tear that one. So not only are they now fear-mongering me about the knee that I injured, but now they're telling me about injury on my other knee and put that in my head, which are really was not helpful for me. I already had kind of a fear-based understanding of my body anyways growing up in my family. We tend to be a little bit more, there tended to be a little bit more hypochondriac type of views on medical things. And so that fear was definitely instilled in me from a child. And by the way, this stuff matters for you too. So it's important to kind of unpack all of those things. How you are taught about pain and injuries growing up is definitely going to affect you in how much pain you experience. So all that to be said, then when I was a senior in high school, I kept having issues. So after my surgery as a freshman, I went back to gymnastics less than a year later, worked back to things, but I constantly had pain, and they didn't send me to more physical therapy. I did not have decent physical therapy. I was discharged way before I was ready, did not have any good return to sport type of strength training, jumped back into gymnastics and had continued knee issues. They gave me braces. They basically just told me there's not much that can be done because I had surgery on it, so it's expected to be crappy. Mind you, I had multiple inch difference between my leg sizes on both legs, so that was not a good thing. I didn't get back to strength on that leg. So needless to say, by my senior year, I kept having issues with that knee, and it got so bad, it was swollen. I was limping. In my first meet, I could not walk the next day. It didn't get better. And so they did another MRI, saw my knee was, my medial meniscus was torn some more. So they went in and did more of that cleaning out and carving away of the meniscus a little bit more. And after that surgery, they told me I definitely was probably going to need a knee replacement by the time I was 30 or 40 because my knee was so damaged. And from then on, every time I had some sort of weird twinge in my knee, I was super afraid of it. I didn't load it. I would start limping. I was just very fearful of loading my knee. And that fear was more problematic if I just would have worked through some of that or had a provider who could have helped me work through some of that. None of those flare-ups would have been bad, and I wouldn't have had the chronic knee issues for 10 plus years that I had and have finally tackled over the last 5 or 6. So with that being said, this is why I'm so adamant about it, and I want you to understand I have arthritis in that knee. Most likely, I was never told directly to my face that I have it, but if I were to go back and look at the MRIs, I'm sure it says that somewhere because of the terminology they were using with me, like bone on bone and wear and tear. So with that being said, as I started to learn more about exercise and load and physical therapy and pain, I started to work through some of the things with my knee, and I realized I had a lot of deficits. And once I started working on those, I actually got better. And so I had to change my fear and my mindset around my injury and around injuries in general. And then I had to load it. And so all of that to say that the evidence now that is surrounding arthritis and wear and tear and bone on bone is that, number one, as providers, we're not supposed to be using those types of phrases with patients or clients anymore because it does promote so much fear and it's not helpful in general. It doesn't help you. It doesn't help me know how to treat you. It doesn't help you know how to work on anything. It doesn't help you get better. So and the number one thing in medical, in the medical profession, right, in the medical field, is do no harm. And those phrases in and of themselves are doing more harm than they are good. So we really need to retire those phrases. The better understanding that we have about the human body right now is our cartilage and our passive structures, like our ligaments, which aren't exactly passive, but they're more of a like backup. They are supposed to be kind of a backup plan and backup support for our muscular control. And there's a concept called Tensegrity, which is very complicated. You can kind of look into it. It is a theoretical understanding of how our body works, and that our bones are all kind of suspended in space by architecture of our soft tissues. And those soft tissues keep our bones from jamming together. And this is something that's a little reductionistic view of what that is, an explanation, but I'm not going to go super scientific in explaining it because you don't need to understand that that intensely to understand that we don't really need to be super fearful of not having a ton of cartilage. We just need to be a little bit more aware. And really what this is going to affect is how we approach exercise and how we kind of make sure we modify loads and things like that. We might just be a little bit more attentive to what you feel when you do an exercise than really to not load you and be super fearful of loading any sort of putting any sort of load on the body. There's some evidence to support this belief and this understanding as well, because most people have some sort of finding the older we get in our joints that and they don't necessarily have pain. So I believe there is an infographic I'll link here, but when it comes to the knee, for example, very specifically, I believe in 80% of people who have pain, they have osteophytes, which are just bone spurs that are a direct result of a lot of force going through the area. But also people who don't have pain, in I think probably it was like 75-ish% or close to that, they also have osteophytes. So we can no longer say that the reason you're having pain is because of these things we see on an X-ray or MRI, because they don't correlate. And because those things don't correlate, we now don't describe pain as a byproduct of what we see in an image. And so we used to think that, and again, this goes back to what I explained a little bit in those pain science podcasts, but the old view is very a biomedical model of treatment. It means that if we have pain, we are going to look at the biology, so at what's on an MRI or what tissue is causing the problem. Now we approach things with a biopsychosocial understanding, meaning that the pain you experience is an experience and a byproduct of not just your biology or your tissues or what we see in an MRI, but also how much social connection and support you have, your fear and understandings and beliefs about the things you're experiencing, your emotions and stressors that you experience, all of the biological, psychosocial contributions. They all contribute to whether or not you're going to experience pain. So I just want you to understand that that is the shift. And unfortunately, not all providers have made that shift. And we're going to talk about what to look for in a provider so you can make a better decision for yourself and make sure you don't go down the path that I did. I believe that majority of my purpose here, at least in what I do on social media and in this podcast, is really to help you not go down the path that I did. I really don't want that for people. It's what I spend a lot of time in my office talking about as well, because by the time people have found me, they've gone down that path. And so a lot of my time spent with them is helping them unlearn some of the harmful things that other providers have said to them. So with that being said, there are some things that if you've been diagnosed, that we want to make sure that we pay attention to. So that's what I'm going to move into now, but I really wanted you to understand the difference in how we used to treat versus how we now treat, and how we we should be treating according to the evidence that we now have, and that we really don't need to fear these types of bone-on-bone, osteophytes, meniscus tears, all kinds of things, labral tears, all these things that we find on MRIs. We don't need to fear them as much, and we need to really, really understand things from a more biopsychosocial understanding. And that I wanted you to understand that things like lifting and exercise and load are not to be feared, and that just because you feel pain with those things doesn't mean you're doing damage. That's really important to understand. And just because you're having a flare-up doesn't mean it's more damaged. Flare-ups or like a big spike in pain are almost always directly related to either doing something that put a lot of load all at once in that area, and or having sleep interruptions, not sleeping well, and or having big stressors in your life, which can be exciting things, even if they're exciting. If it's a new change in your environment, that is going to be viewed at from your nervous system as fearful. So anytime your environment or your routine changes, your sleep isn't doing well, you're feeling more stressed, your pain can be directly correlated to that and has nothing to do with whether or not you actually have increased damage in your joint. So remember, pain does not mean damage. Like if you get one thing out of this podcast, that's what I want you to get out of it. So moving on from there, let's talk about strength training and arthritis and what things you need to consider when we're doing it. Number one, exercise in general is good for arthritis, and there is a lot of support for this, and strength training specifically is also really beneficial, and it can help with just reducing pain. It can help with improving your function, your ability to do things. And a lot of people who have arthritis actually have weakness of the muscles around that area. And so chicken or the egg type of thing, we can talk about whether or not the weakness came before the arthritis or whether or not the arthritis and pain came and we started loading it less. But we do know that weakness is problematic and can contribute to more pain. So addressing the weakness and the limited range of motion is going to be really important. So it's going to be important to understand that exercise should definitely be part of your approach if this is something that you're dealing with. Now, when you are exercising, if you are experiencing pain, it's going to be important that you find a provider who can work with you and help you through this process. A physical therapist should be able to give you an assessment to see what's going on with your knee, because the pain may not have anything to do with arthritis. It may have to do with the fact that your kneecap doesn't move. And I'm using the knee as an example today just because it's the most common that I hear about, but this also applies to any other joint in the body that you have arthritis or any sort of findings on an MRI. Like degeneration in your discs in your back would be another good example. So we want to make sure that we give you a good assessment on what limitations that you have and get you started on a program. But the other thing that they should be really good at educating you about, besides making sure that you feel safe and confident and empowered with the knowledge rather than not use fear-mongering language like degeneration and bone on bone, is making sure that you understand how to modify your activities so that you are controlling the load that's going through that area. A lot of times if we've had issues in one part of our body for a long time, we will lose a capacity or we will have a lower pain threshold. A capacity is how much your tissues can basically absorb and dissipate force without being damaged. So something with a really strong capacity will be able to tolerate a lot more before you have an injury. Something with low capacity is going to be a little bit more weak and fragile, so it won't be able to tolerate as much load before you will get an actual injury. When it comes to pain, however, the idea is more of a threshold because it has to do with how much load your body can tolerate before it becomes, I would say, like fearful or interpreting those signals as pain. So those are not the same thing. By the way, you can have a really high tissue capacity and a low pain threshold. And a lot of times if you've been dealing with chronic pain, you will have maybe a little bit higher of a capacity. So your body's stronger and can tolerate more, but your body's pain threshold's very low, so any little thing will set it off. And a lot of physical therapy is figuring out where your pain threshold is and figuring out how to bump that up by staying under it. So it's really important you work with somebody to find the correct dosage that keeps you under that pain threshold but keeps building that pain threshold up so you can do more and more throughout the day. That is a big part of what we do. It's load management, and we don't always get that right away. We don't always figure it out. So keep in mind, sometimes it does take a few sessions to figure out, okay, so we tried this, oh, we went too high. And to be honest, a lot of your time with physical therapy will be, okay, let's try to work on this and see how you respond. And you come back in the next week or next month and give us a report, and we're like, okay, so let's adjust that accordingly. Sometimes the body tolerates it well, sometimes it doesn't. And a lot of that has to do with also your emotional state and your psychosocial aspects outside of what we're doing in movement. So we put all of that together with you, and we work on that as a team to get you back to what you need to do. So when it comes to the actual movement part of the strength training, if you do have some sort of arthritis, I do want to note one thing that we want to pay attention to, and that is where you feel things when you're doing exercise. Sometimes in physical therapy, we do load through a little bit of pain because your pain sensitivity is so high or your threshold is so low that even small things are painful, even if it's not causing damage. And a physical therapist is going to have to figure that out, and it's hard to deduce, and I can't give you any advice over a podcast about that. But sometimes we do push through pain. Where we typically do not push through pain is a matter of where it's at. So I explain the location of the pain. I will often explain to them where I would like them to feel something and where I would never like them to feel something. And this has to do with the angle of movement. So if you think about your elbow, when you bend your hand up towards your shoulder, so you flex your elbow, there is a closing angle, which is the angle that your forearm makes with your humerus or your actual arm. And there's a closing angle and an opening angle. And the opening angle should just feel some sort of stretch. This is true for any sort of joint. You should feel stretching on the opening side. You should never feel anything anything on the closing side. That is typically an idea that you are jamming that joint. And if we want to make sure that those bones and that joint's not coming into contact, we have lots of space there and room for movement, then we want to avoid those types of sensations. So if you are thinking about the knee, if you are bending your knee, the back of your knee would be the closing angle and the front of it would be opening. So having pain on the opening angle is still not something we push through a lot, but I will push through it a little bit more. I will almost never push through any closing angle. Actually, never. I just never push through closing angle sensations because that is the body giving me information about what's going on deep in those tissues that we can't see. So that is the biggest thing to pay attention to, and the only clear-cut advice I can give you when it comes to strength training and load. The other thing is going to be understanding where the forces are going through your body in different exercises. And I have made posts on my Instagram about this in the past, but a lot of rehab for arthritis or any sort of knee pain looks like squats or front foot elevated split squats, or sometimes we'll do some terminal knee extensions with the band. And I talked about how those things are they're fine. Those are great exercises as long as you're not having pain, but they're not always conclusive. And so we just want to make sure we have a very conclusive plan for you that is not only building the tolerance to load and keeping things strong and healthy, but also making sure we're addressing any sort of mobility or range of motion deficits you have at the joint level. And a lot of physical therapy or rehab efforts are missing that thing. And so if you want to check those posts out, they're on my Instagram. I think I have a reel demoing that. So all that to say, you want to make sure that your program is very the word I'm looking for is comprehensive. There it is. And making sure that you just know that it's all a journey, and sometimes you don't find the right answer to things right away. And so this kind of leads me into the next thing I wanted to talk about, which is finding a provider that works with you. So back real quick to what we just talked about, making sure that you find somebody who can understand forces of those exercises. You probably don't understand them as well. You might not understand what you should feel in those exercises. These are things people have no idea that physical therapy should help you with. And so we're in kind of that world of DIY, I want to do everything myself. And I get that. And also, you just might not understand the things that a physical therapist should be able to help you with. So just wanted to kind of cover those things for a brief understanding of that. And let's kind of cover and move into finding a provider that's best for you and what you should be doing if this is something that you are experiencing right now, or somebody that's experiencing this. The most important thing is going to be making sure that you find a provider. So I will definitely say physical therapist is probably going to be number one for this, but there are some very movement-based chiropractors who are very great at knowing how to exercise. And I will put that little caveat in there because my husband, Ryan, is one of them. And majority of chiropractors are not. So you would have to do some research to figure out which chiro you're working with, but you'll get a feel for it. And I'm going to go through a little checklist with you of things to look for in a provider that'll help you know if this is one that will help you or not. But I will also preface this by saying you don't always know right away. And sometimes you have to put in the effort and the time to get to know them and work with them. And it's just like finding any other sort of person you work with. There are going to be people you vibe with real well, and there's going to be people you don't. And it's really important to find people you vibe with, whether or not it's a healthcare provider or somebody doing your hair. Sometimes it takes some time to build that relationship and establish that trust and make sure that they understand what you need. Not every hair provider or hairstylist is going to have all of the skills that you want for your specific needs, just like not every physical therapist is going to as well. So I think there is a lot of frustration when it comes to healthcare. Rightly so. There's a lot of things on the side that I'm going to talk about that I don't like about healthcare, but keep in mind that it is very similar to finding somebody who does your hair, and it's just going to take maybe a couple providers to find the right one for you. So be patient and keep trying. What you want to look for, let's kind of get into that, is I've already hinted at this a lot during this podcast, but you want to find somebody who, number one, their biggest thing is recommending exercise. Exercise should be the first thing that we go to. Hands down, there should not be a question there. So if you are seeing a surgeon or orthopedic doctor, some sort of physician, and their first thing to tell you is surgery or injections or those are probably going to be the two biggest ones, or PRP injections, steroids, similar things. You want to find another provider, or just make sure that you're going out on your own to find somebody like a physical therapist who can get you started on exercise, because you want to avoid injections of like steroids and avoid surgery at all costs. The outcomes of a cleanup like arthroscopic surgery are, I think there's a research study 2 years later, are very similar to that of just general exercise. And so you have about the same level of pain and function, whether or not you have surgery or you do exercise. I personally would prefer not to put my body under surgery. We throw that term around a lot. Like it's just, oh, surgery, no big deal, I'm going to get a cleanup. But like going under anesthesia is very taxing on our bodies, and it's likely going to be a lot of recovery, and it's expensive, and it's just, I don't know why we think surgery is like this quick fix, because it's really not. The only reason I think it sounds great is because you lay on the table and they do things to fix you, which goes back to that biomedical model, making you feel like you're fragile and need to be fixed. But in reality, the answer is doing the work, and you're going to have to do the work even if you have surgery, because you have to recover from it. So I think that we don't do a good job at really understanding and explaining all of the costs in multiple ways of surgery. So the other thing is steroids are not great for your tissues. They can actually promote degradation of the tissues. So if you have multiple of those, it's putting you at risk for more issues down the road, including things like tendonitis and general just not healthy tissues. So you don't really want to be doing those either. And then PRP injections they don't have very good evidence. Same with supplements like chondroitin. Those things are not supported right now. They have limited and poor evidence. There's like very small studies that may have improvements in pain, but honestly, so does a placebo. And so far, they are not showing they are any better than a placebo, meaning if I tell you your knee is going to get better if you take this sugar pill, you probably will have a good outcome, because honestly, the placebo and the hope and the thought of getting better is going to make you feel better in general. So I would not spend your money on those things. I would save your money and actually spend it on a provider who's going to be able to do the things that I said, because not only are you going to address all of the things, but you're going to learn some very valuable lessons. If you really find a provider who is good at coaching and can work with you, you're going to learn a ton about your body, and you're going to learn skills that you can apply for the rest of your life. And that's at least what I try to work on with my clients and my patients. So again, sometimes we are hard to find in the medical field. Usually we have to go outside of insurance because we don't have time to do that when we are in a typical insurance clinic. I worked in one in my first year out of PT school. You're typically seeing 2 to 3 patients an hour. The clinic has certain expectations of you. It's just not very good care, and you can't change my mind about that. So majority of the time you're going to have to find out a good therapist outside of insurance, but I promise you it is going to be well worth the money. So let's talk about things you want to make sure that you find in a provider and a physical therapist. One, they should be using language that makes you feel empowered. If they are using things that I talked about earlier, like wear and tear and bone on bone, and making you just generally feel afraid of loading your body, that is a time to say, nope, thank you, next, moving on to the next one, because you should be able to feel like you're building rapport with them and that you are feeling empowered with knowledge and stronger in your body and hopeful. And majority of the people that I work with, they leave my office the first time saying that or after our first consult saying that they feel hopeful. And that's what you should feel after the first session with somebody who is going to work well with you. Second thing is making sure they listen. I know this goes without saying, but they should be listening to you, and they should really be taking the time to talk with you. In a lot of my sessions, I spend way too much time talking to patients, and I say way too much time because sometimes I want to get more to the movement part, but I will always put that aside because majority of my patients need to be validated, because the medical field is so crappy at doing that, that I have to spend time kind of cleaning up the mess of a lot of other providers and helping them unpack the stuff they've been told and providing them with the evidence that I'm telling you today. And so it's really important that somebody listens to you and you feel like you vibe well with. If you feel like you're at ease when you're talking to them, you're going to be more likely to share information that's helpful. I can't tell you how important that is, building that relationship, because a lot of in the past, patients that I've worked with have told me things they didn't tell other people or wouldn't have felt comfortable telling other people. And if they didn't feel comfortable telling their other providers, it could have greatly impacted their care. So you want to make sure you feel comfortable with your provider. And that might not have anything to do with their knowledge. It might have to do with how good they are at talking to people and communicating. And it's okay if you want to keep searching for somebody that you feel comfortable with. You're right. You've reserved the right to fire your provider at any time. I will give a little side note to that and say, please be patient with your providers. We are humans too. And make sure that you are doing the work to communicate your expectations very clearly. Most of the time, providers suck. And we just are not great at communicating and listening. I will validate that, but also maybe take a little responsibility and make sure you are being very clear about your communication as well. Because I have worked with people in the past. Well, I haven't. Ryan's had a couple stories of people who just did not fully communicate well. And we always step back after those types of sessions and think what we could do better. So as you are going through this, make sure you are clearly communicating your goals, your expectations, things like that. And as a provider, I'm working with my person and my patients and clients to make sure that they understand those things too. So we're going to make sure that you understand what I expect of you. You're going to probably be doing 20 to 30 minutes of exercise per day. Like that's going to probably be required, and more on other days depending on things. But I will make sure that I ask what you are capable of, and we will make sure that we kind of navigate this whole process and make sure that it's realistic for you. And I will make sure that you understand what's required to actually get your knee better, and I will try to meet you halfway. So those are things that your provider should be doing with you. And if they are not, again, those things are red flags. And and you can always find another provider. And if you feel that you are struggling with finding a provider, please reach out to me, and I always try to do my best with giving some resources. And if you've tried lots of providers and you feel like you have nagging things still, you can always reach out to us, because we do, both of us, Ryan and I, do consultations. Ryan has a little bit more of an open schedule than me because I do all of these other things, but we're both available and happy to help and do consultations and work with people virtually. So you can always message us for that. But I think that covers just about everything that I wanted to talk about. So I just want to really hone in today that your body is so strong, resilient, and adaptable, and you really need to find providers that make you feel that way. One of the things that I just remembered that I did not speak on is something that I learned when I was in my first year out of physical therapy school, my first year in the clinic. One of the patients, who is not a patient of mine that I saw regularly, but he did get on my schedule a couple times, was post-surgery. He had a shoulder rotator cuff repair, and he was an equipment manager for a surgeon's office. And one of the things that he told me that I was not aware of, I was aware of this on a global scale, but not this specifically in detail, was that a lot of surgeons are part of practices that have a certain quota they have to meet. So they have to have a certain number of surgeries. They have to bring in a certain amount of money per month. And if they do not meet that quota, they owe the practice money. They have to pay money to the practice. Now, here's why that is problematic. If you couldn't deduce that on your own, if you're sitting here like, oh my gosh, I can't believe it. I believe it. Our healthcare system is effed, like in a lot of ways. And this is just one of them. So if you're going into a surgeon and they are low on their quota that month. Now, not all surgeons are this way. I don't want surgeons to come at me because surgery has a time and place. But a lot of the time, surgery is way overdone. And I do believe this is one of the reasons why, is because they do have a financial interest. And it's not even a financial interest. It's just they're going to owe money if they don't hit their quota. And that means that they're going to be biased towards recommending surgery, right? Because it's going to make the practice money. And that is really problematic. And it's just like one of the examples of why surgery is over-recommended. I also think that a lot of surgeons are just not up to date on some of the new evidence, and they just look at an image. They say, okay, well, here is this thing. I can fix that. Let's go in surgery, and bam, let's be done. So there's a lot of issues with that. And it's a big reason why I wanted to start this podcast, is to help spread some of the more evidence-based information, make you feel empowered, help you understand some of the interplay between all of the layers that go into healthcare and offering advice and seeking advice. So the only way that you can really combat that is just make sure you are getting multiple opinions. And I really would recommend seeing a physical therapist. We do have doctoral degrees now, which is a whole nother discussion. But an evidence-based physical therapist will be able to provide you with good information on whether or not you should be considering surgery. And if you've never tried physical therapy and you have some sort of pain, or you have arthritis or something you see on an MRI, you need to be trying physical therapy first, majority of the time, if not always. And a physical therapist will be able to recommend when or if surgery should be considered. So that actually concludes everything that I wanted to say. If you learned anything and had a big light bulb moment from this podcast, as always, I like to hear about it. If you know somebody who is struggling with some sort of arthritis or finding on an MRI, I kind of put those two together because a lot of the like meniscus tears and things like that kind of get lumped in. And it's similar advice for those as well. So send this episode to them so they can hear it. With that being said, we are finished with this episode. Hopefully you learned something great. I will see you on, or talk to you on, the next one.